Hello, my name is Maureen Revels and I am the Director of Midwifery at the Midlands Regional Hospital in Portlaoise. I'm talking to you today about the maternity services we provide here in the hospital. We work with a range of healthcare professionals including dietitians, physiotherapists, medical social workers, to name a few of the services available should you require them. We are currently developing our midwifery-led clinic, which is available to women who have a low risk pregnancy. If you have any questions, you can talk to your midwife during your antenatal visit. The mychild.ie and whatsupmum.ie websites are excellent resources available for pregnancy, labour and baby care information. We recommend as a hospital that all women are vaccinated against COVID-19 to protect both yourself and your baby against COVID-19 infection.
You put your cold water in first, you add your hot, you just check it with your elbow. If it's comfortable for your elbow, it's fine for the baby. It's about 36 degrees centigrade, the water temperature. You put your hand underneath the baby's head like that. You just took the baby under your elbow resting on your hip. Now I'm holding the baby in the same position and I'm going to wash the baby's hair. So just wash it nice and gently. This is a very good baby. And I'm going to come back onto my mat. And I'm going to lie the baby back down and I'm going to dry the baby's head well. Babies lose a lot of heat from their heads, so make sure that you dry the baby's head very well. Now, when you're lifting the baby into the bath, just turn the baby over on its side, over in this position. Just put one arm, your left arm, underneath the head and hold on to the left arm. And put your right arm underneath the bottom and hold on to the left leg. Now you see there is no way this baby's going to fall on me. I've got the head well supported with my arm here on the left and I've got a good grip of the baby. Now nice and gently you're going to let the baby into the bath. If the baby's enjoying it, of course, just leave them in for a little while. Babies are very used to water from being inside, so they love the sound of the water. I'm going to lift the baby out again. Now you see I'm lifting the baby out nice and gently. So you settle them down, give them a little cuddle. Settle them down and then you're going to dry the baby off well. Don't forget areas where they can get sore if you leave them wet. All babies are quite fat in here, so get right in there under the chin, because if you leave areas wet they're going to get red and sore. They're all get right onto the armpit here where they're like that, and another areas get right onto the behind the knees and in the groin area. They're areas that can actually get sore if you leave them wet. So you make sure that you dry those areas off very well. I'm going to do the cord when my hands are clean. So I'm just going to take a little bit of water. I've got a little bit of cotton wool here and I'm going to clean the cord, so I'm going right down to the base of the cord. Go right down to the base. Now the cord stump is clamped at delivery to prevent bleeding. That cord stump is going to get darker over the first couple of days. It's going to fall off in about 5 or 6 days. And when the cord stump falls off, the cord clamp falls off with it. You're left with the oozy area that stays oozy for nearly 12 days. And you clean it for nearly 12 days. And in 12 days, it look like you and I, and you forget about them. If it ever gets inflamed, foul smelling, bleeding, always take your baby to a doctor or a clinic.
Congratulations if you've decided to breastfeed. This is the best start in life you can give your baby. Breast milk is unrivaled as the ideal food. Not only has it the perfect mix of nutrients, but also all of the infection-fighting antibodies your baby needs. However, like anything, breastfeeding is a skill that needs to be learnt, but once it's established, it will give you great pleasure.
Breastfeeding is the very best start you can give your baby in life. It is a very special, unique formula, tailor-made for babies. It actually protects your baby against all known infections, particularly ear infections and chest infections, and also protects your baby against viruses. We now know that breast milk also helps develop your baby's nervous system. For you, breastfeeding is really good. It helps you build up a unique bond with your baby, because when you breastfeed, you release lots of lovely hormones that help and aid this bonding. It also helps you get your figure back, because you burn up 500 calories more per day when you breastfeed. And it has a great protection against ovarian cancer, breast cancer and osteoporosis.
While you're still pregnant and in the early days after the birth, your breasts begin to produce a substance called colostrum. This is extremely easy for your baby to digest, making it the perfect first food. The first hours after delivery is the ideal time to get started on your breastfeeding.
Breastfeeding on demand is recommended with breastfeeding. That doesn't mean leaving the baby asleep all day, particularly in the early days and weeks of breastfeeding. Babies should be woken up every 3 to 4 hours if they're not demanding feeding. However, breastfed babies can often feed much more frequently than that.
How your baby is attached to the breast is key to the success of breastfeeding. This is called latching on. When your baby is in position, wait until their mouth is open wide. You can tease it open by gently pressing the upper lip with your nipple. Bring your baby to your breast, the chin and lower lip first. Baby's mouth should cover all your nipple and about 1 inch of the brown circle, the areola, around your nipple. Your nipple should touch the roof of the baby's mouth with his tongue underneath. Once your baby has a good latch on, there'll be a period of quick suckling to get the milk flowing, and then rhythmic suckling. When your baby is properly attached to your breast, you'll notice that his mouth is wide open with a big mouthful of breast, and his top and bottom lip are curled out, like the letter K. His cheeks are full and rounded, and his chin is pressed into your breast. The suckling pattern changes from short sucks at the beginning to long, deep sucks with pauses.
There are many different ways to position and attach your baby, but there's some key principles. So I'm going to talk you through a number of different holds. The first thing I would say to mums is get yourself comfortable.
Finding a position that suits you and your baby is important for successful breastfeeding. Make sure you're comfortable and well supported. Use pillows or cushions if necessary. And whether you're sitting up or lying down, keep a drink close by, and most of all, relax.
There's some new research out on a new position for breastfeeding called biological nurturing, and this actually works very well in attaching a baby on a breast. In this position, the mother is not sitting up bolt right upright or lying down. She's semi-inclined and she's lying the baby on top of her body. And in this position, the baby actually self-attaches. This hold now, if you put the baby in what's called the crook of your arm, lying along your forearm, and position the baby with its tummy to mummy's tummy. We call it tummy to tummy. With the baby in a straight line, and if you tuck the baby's bum under your other breast, it makes for very good alignment. Then we encourage mothers in the early days of breastfeeding to support their breast with feeding. You can do this by going in onto the breast with a C hold. Now, mothers often instinctively go in with a V hold, but that'll actually make your nipple very sore. So if you support the breast in a C hold with the under finger well away from the areola, that will actually make a very good shape of the breast for your baby. It's tummy to tummy, it's nose opposite nipple, and it's a C hold on the breast, and when the baby opens his mouth, you bring the baby swiftly onto the breast. So we say bring the baby to the breast and not the breast to the baby. This will actually make for very good attachment. Another variation of this hold is actually something called the cross cradle hold, and a lot of new mums like to initiate this with breastfeeding because they feel they have a lot of control in the actual initiation of the latch. In this, it's similar to the first hold, except you're doing the C hold with your other hand, and you're holding the baby's back and neck with the baby in straight alignment again. So it's very important that you hold the baby's back and neck, and again you're supporting the breast in a C shape. And you're bringing the baby to the breast, waiting for the baby to make a large open mouth, and when it makes a large open mouth, you're swiftly bringing it onto the breast, and then you can put your arm around the baby like this and relax into a nice comfortable breastfeed. There's another hold you can use for breastfeeding called the rugby hold or the football hold. So in this hold you support the baby's back and neck, let the baby lie along your arm and tuck the baby underneath your breast. And in this position you use the same principles of nose opposite nipple and bring the baby to the breast with a wide open mouth. This is a very good position to use for babies, particularly twins. Another way of breastfeeding your baby is lying on your side with your baby tucked up beside you. A lot of mums breastfeed lying down in bed, particularly late during the night. With this, the mother lies on the bed with two pillows, usually her head on the pillow and her shoulders on the bed, and tucks her baby up beside her, nose opposite nipple. Again, it would be the same principles of bringing the baby swiftly onto the breast when the baby makes a wide open mouth. This is a really comfortable way to feed a baby. There are lots of good indicators that breastfeeding is going very well by looking at your baby's output. In the first couple of days, the babies have very little wet nappies, and ideally one wet nappy. Day 1, 2, day 2, 3, day 3, and when your milk comes in on day 5, the baby will normally have about 6 wet nappies in 24 hours. This is a really good indication the baby is breastfeeding well. Another very good indication is actually looking at the stools. And babies have meconium stools for the first day or two, and they have a changing stool which is usually black, green or brown, day 2, day 3, day 4. And when your milk comes in, a baby who's breastfeeding really well will have 3 to 4 yellow seedy stools in 24 hours. If your baby has these sort of stools, the baby is breastfeeding very well.
Your breastfeeding is going well when your baby is alert and waking for feeds, has a minimum of 5 or 6 wet nappies and 2 soiled nappies per day after the first week, has gained weight, sleeps and settles during the day, and is feeding comfortably and pain-free.
If a baby is not correctly latched on your breast, you won't see rounded cheeks, you'll see dimpled cheeks. You'll also see the baby doing very short little sucklings as opposed to long rhythmic sucklings, or you may see a lot of the areola. In that case, you also may feel a lot of discomfort feeding. So if that happens, it's very important to break the latch and start again. And the best way to do that is actually put your finger into the baby's mouth and let the baby actually suck on your finger and break the latch very gently. Signs that breastfeeding may not be going as well for you is if the baby is not wetting and dirtying its nappies. So particularly in the early days, if you look for urates in the nappy, which is pink staining, and if the baby is not passing sufficient wet and dirty nappies, it would be very good to contact a health professional to help you with your breastfeeding.
Infant formula can provide the correct nutrients for your baby, but cannot provide the protection against illness. As it can take some time before a newborn's immune system develops, all equipment must be washed well and sterilised before feeding.
It's very important to keep all equipment used for baby feeding thoroughly clean. It doesn't matter whether it's breast or bottle feeding, we're talking bottles, teats, breast pumps. They need to be washed thoroughly and then sterilised. This is to prevent babies getting infections.
There will be clear and detailed instructions on the packaging of the formula you use. Make sure you follow them precisely. To prepare a bottle feed, boil fresh tap water in a kettle. When it's boiled, leave it to cool in the kettle for 30 minutes, but no longer. Clean the work surface well and wash and dry your hands. Remove the lid from the steriliser and take out the bottle, the teat and the cap using tongs. Carefully pour the required amount of boiled water into the bottle. Using the clean scoop provided, add the exact amount of formula to the boiled water. Remember, adding too much or too little formula could make your baby sick. Reseal the packaging to protect it from germs and moisture. Screw the bottle lid tightly and shake well to mix the contents. To check the feed is not too hot, shake the bottle and place a drop of liquid on the inside of your wrist. It should feel lukewarm, not hot. To cool the feed down quickly, hold the bottle under cold running water or place it in a large bowl of cold water, making sure the water doesn't reach above the neck of the bottle. Your newborn will probably take between 2 and 4 ounces per feed during the first few weeks and will probably be hungry every 2 to 4 hours. This is only a guideline, and it's recommended to feed your baby whenever and as often as they look for food. Do not try and make your baby finish a bottle if they don't want to, and never reuse leftover milk once your baby finishes feeding.
There are hunger cues to look out for. Babies will stick out their tongue, they may pout their lips, they may put their hand in their mouths, they may eventually start crying, but don't let your baby cry too much before a feed because they can take in quite a lot of air, which can cause discomfort for them later on.
When babies feed, especially from a bottle, they take in air. They can also take in air if they cry before feeding. If the air isn't brought up, it can get trapped and cause discomfort later on. There are some common positions for winding, but use whatever suits you and your baby best. Try holding your baby, leaning against your shoulder and rubbing or patting their back. It's a good idea to put a towel or a cloth over your shoulder in case more than wind comes up. Another position is sitting your baby upright on your lap, supporting him under his chin and rubbing his back. Or lying your baby face down across your lap and gently rubbing or patting their back can also be a good way of bringing up wind.
Here at the Midlands Regional Hospital Portlaoise, we want to ensure that you have the best possible experience of pregnancy and post-birth. My name is Dr. Kat Hines and I run the perinatal mental health service here.
The baby blues are very common and considered normal. They usually begin on day 3 after your baby has been born. You may be more tearful and emotional than normal. You may feel irritable and isolated and lonely. These feelings are unpleasant, but usually pass between 1 and 2 weeks. If the baby blues get worse or last for longer than 2 weeks, or if your mood becomes very low several months after your baby is born, you may have postnatal depression. It is thought that 10 to 15% of new mothers will develop postnatal depression, and it can last for months or even years if it is not treated. Your family and friends may notice that you have postnatal depression before you do. The signs and symptoms of postnatal depression include feeling sad, anxious, and alone. You may feel guilty, irritable, and angry. You may experience panic attacks. You may not enjoy being with people or even your baby. Other symptoms of postnatal depression include crying easily, feeling rejected by your baby, worrying a lot about your baby, loss of appetite, feeling inadequate, feeling tired all the time, and problems sleeping.
Get help from your GP or public health nurse if these symptoms last for more than 2 weeks. The most important thing you can do is ask for help.